Hi there and welcome back to the channel. In today's video I'm going to show you as a healthcare professional how to get the most out of models like ChatGPT, Claude and Perplexity. Now from experience I would say at least 90% of the people who actually use these models actually are using them incorrectly. This is mainly down to poor prompting and not knowing actually how to ask the AI what they want. The output is only as good as what you put in, so if you put in rubbish, expect to receive a rubbish answer. So the agenda for the video today is discuss some different tools, show you the best practices when prompting, and then provide some real life use cases. Before we get started, I just wanted to say that AI will not replace you. However, the people who know how to use AI effectively will replace you. And I'd also like to touch on an important topic, which is ethics. Whenever you use a model such as ChatGPT, it's very important to stay compliant and obey the regulations. Of course, these regulations will vary on where you are in the world. For example, if you're based in the US, then it will be HIPAA. So some of the prompts that I show you today, I wouldn't be copying them word for word because they may not be compliant with the rules in your geographical location. When prompting, I want you to understand that one of the most important factors is context. For example, if you say explain these test results, explain them to who? A doctor, a taxi driver, a patient, explain them to who? Provide context always. So let's talk about the different tools that AI has to offer. Now, long gone are the days of where there was just ChatGPT and that's all that everyone ever used. We have a fast growing number of generative AI solutions and tools, all with different use cases. And in fact, I'd say the more you try and use these different tools, the more you realize that there's no sort of ultimate tool just yet. Some tools are great for some things, but then rubbish for another thing. An example of this is ChatGPT is absolutely nowhere near as effective at providing real-time data and real-time sources as Perplexity is. Therefore, I will always preach for people to try out different tools, not just stick with one. For example, a lot of people will just stick to ChatGPT. I would definitely not do that. You want to test different ones out. You can then find which is the best tool for you, which is the best tool for your situation or specific task. I'll just list 5 tools that I would recommend using quickly. So first is Perplexity, that's best for research. Then I'd also test out Claude, ChatGPT, Bard, and for a healthcare specific generative AI tool that's specifically made for people like you, I would try Compliant ChatGPT out. I'll leave the link of those all in the description below. So you've picked your tool, now what do you do next? So the first thing I would do is be specific. The more specific you are, the more accurate of a response you will get. So I'm going to show you an example of this. Now the chosen model today will be Claude.ai, and I'm going to ask it to explain diabetes to me. So this is not very specific. So I've asked it the question and it has spit out a pretty basic answer to me. But what I actually wanted to know was the difference between type 1 and type 2 diabetes. So here, as you can see, I've been far more specific with my questioning. Now I'm going to ask it, I'm going to ask Claude, and now just look at the difference in quality of answer. I have received exactly what I want, a lot more of an in-depth response from Claude. The next thing I want you to do is provide context. Treat the conversation like you have just met a new person who knows absolutely nothing about you. For example, you could describe your goal, your audience, or the use of tone. An example prompt is the one that I have on the screen here. I've told the model exactly what I'm doing. I'm creating a presentation on effective communication, exactly to who I am targeting and the exact speciality that I'm going to talk about. And then I've asked it for the key tips and techniques along with specific examples. Even more specific of an audience is newly graduated nurses who are just starting their career, and I want the tone to be encouraging and supportive. And within a couple of seconds, we've got a response, and it's actually created a document for us, which you can see on the right side of the screen here, of pretty much a script that we can follow for the presentation. Now, just by being specific in exactly what I wanted, I've got a whole document there that I could use to help me present this presentation to my exact audience in the exact tone that I want to use. Next is give the LLM a specific job role or job title. This will increase the chances of you getting exactly what you want. Here I've given it the role of a nutritionist with 25 years of experience, and I'm going to ask it the risks of a vegan diet to a patient suffering with Crohn's disease. And there we go, just like a nutritionist with a lot of experience would, it's listed all the different risks that someone with Crohn's disease could have if they undertook a vegan diet. And my fourth bit of advice would to be ask the model for examples. Asking for examples can help you further understand the answer that it gives you. This technique is most effective when trying to get your head around complicated concepts. So yeah, if you don't ever understand or fully understand an answer that the model has given you, just ask it to provide you with an example. So moving on, I am now going to provide some use cases and examples of how this can be applied in the medical field. I'm not going to cover them all because I would be here for absolutely ages and I probably don't know them all, but instead I've listed 4 or 5 of my favourite ones and we're just going to go over them quickly. What I would say is I wouldn't go copying any of these exact prompts that I'm about to use as examples because they may not be compliant with the regulations in your area. You may need to change them up just so you're compliant in work. So the first use case is summarization. AI is extremely effective at summarizing text, and of course with the implementation of EHR there's a lot of information, and for staff to read it is causing a lot of burnout. Sometimes it's 1,000+ hours just to read over a record and no one really has time to do that. When using AI to help you summarize medical records, for example, first of all I wouldn't be using Claude, I would be using something like compliant ChatGPT. But the first thing you want to do is provide context, so your role. So let's say I'm a cardiologist. You want to tell it that I'm a cardiologist. You then want to tell it to be clear and concise. And you'll also want to tell it exactly what you would like to focus on, as you can see highlighted here. Now I've just grabbed a fake patient record. This isn't a real one, I've just made it up myself. Of course you blank out the patient ID. I've left the date of service in as yesterday, and I've just provided a quick summary of the medical record, and I am now going to ask it the question to summarize the cardiac status of this exact patient. Now I know the medical record I provided wasn't long or anything, but just like that, I now don't have to read through that full record. I can just read this summary here that provides everything that I asked for on the left side. I've now got here presented very simply and clearly. The next use case is use the LLM as a medical consultant. Now an LLM can actually do a pretty effective job as a basic consultant that can support you in your decision making. Of course, be wary of the answers it gives and double check that the answers are actually right, and of course be cautious with the information that you give it. So as always, I've provided the context of the role, the experience. I've then given it some information about the patient, some of the symptoms, some background information, and then I've asked for what diagnostics test should I order, and what immediate steps should I take, and what potential diagnosis should I be considering. And of course you can pause the video to read the full prompt just so you understand the context a bit more. And just like I've asked for, it's given me the immediate steps, some diagnosis tests to order, and potential diagnosis to consider as well. Like with the other examples, just feel free to pause the video and read the responses, and also read what I've actually given it in terms of the prompt. Another quick bit of advice, or another tip I like to give, if you find all this a little bit complicated and confusing, you can ask the LLM to put the results into a table, and as you can see on the right here, it just pretty much gives me steps to follow, so it just looks a bit more simple and easier for me to understand from there. Now the next use case is getting the LLM to change a result or an instruction into the patient's language. Sometimes it can be difficult for a patient to actually understand what you're trying to say to them. Let's say you are dealing with a mechanic who is facing heart issues. You could actually get the LLM to explain his heart issues in mechanical terms, such as problems with the pipes, for example, just making it a bit more easy for them to understand it. Or another example could be for a dentist who is trying to explain the importance of brushing teeth to a 5-year-old who has a hobby of dinosaurs. As you can see here, I've given it the role, and I explain the situation. I have a 5-year-old patient who has trouble brushing their teeth. The patient is enthusiastic about dinosaurs, so could you please emphasize the importance of brushing your teeth to a 5-year-old using a dinosaur analogy, making it fun and easy for them to remember. And I'm not going to read it all out, but it's given me a pretty fun answer there that you could easily explain to a 5-year-old, and it's quite a fun and interactive explanation, so of course feel free to pause and read. Third example of this could be to change a patient summary or a visit summary into the patient's native language. So the example I have on the screen here is, please rewrite my after visit summary in Spanish for my patient. Keep the reading level at 5 years old so it's easy for them to understand. And I've just made a fake summary here. And in a matter of seconds, it's created me a document that's translated all this into Spanish at a 5-year-old level reading. Now for these final few examples, we're going to switch over to ChatGPT just to see how else this performs in comparison to Claude. The use case we're going to be covering here is drug-to-drug interactions. This can help you avoid some dangerous pitfalls when providing patients with medication. Now of course be wary that the LLM might not be able to identify all the dangerous interactions, so always double check. So here of course I've given the LLM the role that it needs to play. I have given it the problem with the patient, and I've also stated an external problem that the patient has, and I've asked which medications I should never mix because of these. And within a matter of seconds it's advised me on 2 different medications that I should never prescribe to a patient with these exact issues. Now just for another example here, I have listed the medications that this patient is currently on and asked it to identify any medication interactions that I should be aware of within the list. And there we go, it spat out the answer. It says I shouldn't be mixing aspirin and warfarin, and it's also given me some recommendations here. Of course, feel free to pause the video and read the full answer. Now the final use case is improved patient interactions. I will just continue using the example we used for the previous use case, but we can leverage the LLM here to help improve our patient interactions. So I've pretty much just said that the patient is currently worrying me and I'm not sure if they're suffering from depression. As a doctor, what would be the best way to approach them about this concern? I've then said, tell me how someone with depression may feel emotionally so I can have a better understanding of how they are feeling when I communicate with them. And quickly it's just wrote this answer out for me and given me a guide on how to approach a patient who may be suffering with these issues. And not just that, it's given me some emotional symptoms of depression, and I can see if the patient matches any of these. So that is everything that I wanted to cover in today's video. Now there are many more use cases for these models in healthcare, and I've only shown you a few here today. And I really do hope that you learned something from this video and you can now use these models more effectively. Now of course feel free to get in touch with me on LinkedIn if you have any questions. The link to my profile can be found in the description below, and in the description you can also find a link to book a call with us if you'd like to discuss the potential of implementing AI into your practice. And you can also download our free ebook which demystifies AI for non-technical business owners, and the link is also in the description. If you'd like to continue watching the channel, then click here for another one of my videos. Otherwise, I will see you in the next one.